So next we're going to talk about how the cranial rhythm is created. If you were to dissect your brain, you would find this hollow space within your brain called your ventricular system. The fourth ventricle is way down by your cranial base, and John Upledger actually created a technique called the CV4 hold because that's the closest you can get to this ventricular system and actually mechanically ask the system to slow down or stop. So this fourth ventricle is actually where cerebrospinal fluid is mostly made. There are a lot of other areas that produce cerebrospinal fluid, but this is the main location. There's actually a nerve impulse that comes up to your sagittal suture, which divides your parietal bones, that has a stretch receptor. As this makes fluid, that stretch receptor gets activated as that sagittal suture stretches, and it signals fourth ventricle to stop making fluid. So where does the fluid go? You have what are called an arachnoid villi that's all along the meninges of the spinal cord, where it has a constant reabsorption rate of that fluid. So I like to use the bathtub analogy. So you've got this bathtub and you have a constant water level. There's also a washcloth shoved in the drain that has a constant drip. That constant drip would be your arachnoid villi. So as that water is leaving the bathtub, the water level is dropping. And let's say it hits this magic mark where that stretch receptor is coming back together. It signals the shower to turn on and refill the tub. So it's signaling fourth ventricle to make fluid, refills the system, and once that stretch receptor gets signaled again, the shower turns off and that arachnoid villi is refilling or is pulling things back into the circulatory system, and that sagittal suture comes back together. That same tissue that covers the brain, that is involved in this intercranial membrane, covers all parts of your brain, all parts of nerves. Every nerve that comes out from your cranial nerve system, all of your nerve roots are covered in this same material. So when we're talking about cranial work and using these bones as lifts, it's a continuous web, and you're constantly working with this system to monitor how the system is responding to those lifts. So being able to feel the cranial rhythm and identify that this system is working is the key to craniosacral therapy.